Here's the hick Dr. Ellis, the number one asshole. That's what my wife said. So she's right. Okay. It's November 25th, 2024, Thanksgiving coming up. I think it was in Civil War. Some lady wrote Abe Lincoln, we needed to have a day of Thanksgiving. In that hellacious war, we have a day of Thanksgiving. That's America. Okay? And we're supposed to be truth, justice, the American way, because we've all read Superman comic books. The trouble is, in federal workers' comp, VA disability, and litigation all around, sometimes it's very unfair because of the bias against the inner litigant. Okay. Here is from KK from Iowa. I think you're awesome. Oh, yeah, it's because I'm so sexy. Okay. Okay. Federal Workers' Comp, we call it OWCP, Office Workers' Compensation Program. That's the administration of the law, which is the Federal Employment Compensation Act. It's Federal Workers' Comp. Okay. Can I get a lump sum? You can always do that. You pay a 4% penalty. Okay. But if you knew you were going to die of cancer, your kid needs to go to college, you take a lump sum. Okay. Okay, so 4 years ago, a CA2, that's a cumulative trauma came for PTSD, okay? And stress, anxiety, depression, several work incidents, some involved a hateful federal judge that threatened to throw me in jail, and just, then you went through shit. I've heard this story. If you go to ellisclinic.com, that map, every one of those pins have this horror story. Now, hopefully, we will get an investor and we'll start. You get to come in and tell your story, and let's talk about the people. Let's name names, okay, and the crap you have to go through. Because they're doing it anonymously, and they should not be able to do that anonymously. We're going to call them on the carpet front. Okay, so anyway, you got PTSD. You've been on leave without pay. You should be on workers' comp. That's at 75% of your pay tax-free. Unless you're single, then it's 67% of your tax-free. Okay. So you may not be on leave without pay. You may be on workers' comp. You may have been on leave without pay to begin with, and it's converted to workers' comp. Okay. All righty. Now, you just now got Office of Personnel Management, Federal Employment Retirement System. You just got approved for that. Now, federal workers' comp, if you're independent, is 75% of your pay, non-taxable. FERS is 40% taxable, 60% taxable, and then 40% taxable. Keep your FERS in the safe deposit box. You can always go back to it. I had one person said, I'm leaving the 75%, I'm taking the 40, because every time I see Department of Labor, I about have a heart attack. That, I said, probably had 10 years of your life. You'll lose a lot of money, but live longer. Okay. All right, but just have someone to explain to you what's going on. Okay. You want to stay on workers' comp for as long as possible, you stay until you die. Example. Postal employee, hips, knees, and ankles, walker. He's 60 years old. He was on workers' comp. OWCP, Federal Workers' Comp. And there's nurse case manager wants him off workers' comp at 67% non-taxable, and on FERS, 40% taxable, and then they're out. It's Office of Personnel Management, doesn't cost the post office, and they're gone. And I can see where the post office would think that's a good idea. I said, that's a good idea at the post office, but you hired him under 1916 law, which is ridiculously fair. And the only change, well, there are a few little changes, but the only real change was in 74, where you get to pick your doctor, and your doctor's medical opinion has more probative legal value. It's not fair to the government. If you'll stay with it, and you get a doctor who knows his beans, you'll always win, if he's got balls. Okay? There aren't many of us. Okay, now, down the road, can I get a lump sum? Yes, can. Believe that there's long mental health. You're going to have the mental health problem all your life. Okay? Hire an attorney? I don't think so. Well, I've done 1,587 trials and depositions, including federal criminal court for federal employees and veterans. I've done oral hearings. We've not had to do an oral hearing since August of 2022. Because now they say it's Ellis. You don't need it. All those things you requested, we're just going to give it to you. It's not worth the trouble. Because all I do is I require the government to follow their laws. And the laws are very fair. All righty. Do you need a hire attorney? Try it yourself with somebody helping you first. I just tell you horror stories of people spending thousands of dollars for attorneys and nothing ever happens. There's one law firm in Texas that advertises federal workers' comp and will not do an oral hearing, which is just, you make it ask, I want to do an oral hearing. And now, by the way, every oral hearing I've been to, when I've been to Employee Compensation Appeal Board, when I go to federal criminal court, it's just fair, just pragmatic. This is the law, let's do it. No emotion, it's just fair law, and I always win. Right? Lawyers don't. Okay. Some are good, not many. And there are not many lawyers that do federal workers' comp. In 2013, the head judge of federal workers' comp and I and another attorney did a seminar for the OWCP litigation review group, a loose group of attorneys, good guys and gals that do federal workers' comp. There are 23 attorneys in that room, of the largest employer in every state and the largest employer in the United States. Now, once a year, the Oklahoma State workers' comp judges put on a seminar at Stillwater because the auditorium is big enough to handle 300 people, plus all the booths and all that stuff. That's just for one state. 23 attorneys for the whole federal government. So it's going to be hard. Okay, and there's some really bad ones out there, and some really good ones. Now, hire attorney, but try it yourself first. My medical legal department would be glad to advise you what to, because you get to do it yourself. You get to send under e-comp, which is the way you send electronic stuff to the government. You actually have access to the prosecutor's file. For instance, a claims examiner with only 12th grade education, no training in medicine, no training in law. You don't get to know their last name. You really don't even know the first name because all you get is the CR code, and unless you can read it, you don't know their name. Okay, I mean, this is good. That's no wonder we have problems, and a lot of them have attitudes, and they're overworked. Right? And they got to get something done in 30 days. So a lot of them just send you for second opinion, and just run up a bill. But anyway, okay, all right, so. You can. So anyway, the patient, our patient, scanned her phone records, caught the claims examiner a lie, sent it to e-comp, and so it's there it's their public domain document. It's not public domain, but it is in the document in the government. If you allow someone access to it, caught the claims examiner a lie, and suddenly all her questions and all her things that she requested were passed. Or I had a slip and fall, an accepted contused elbow, strained neck, and 4 bruises, just to fall down, a hip. Now, in federal workers' comp, the law is so fair. Let's say you have a bruise on your hip, and then 50 years later you need a hip replacement. That's enough to make that service work-related. Wouldn't be in state workers' comp, would be in VA, but not in state workers' comp, certainly not in criminal law. But anyway, but since the 4 contusions were on the emergency report, we asked for those to be approved. And of course, the claims examiner did not respond, which is illegal. You got to respond in 30 days. Just give us a denial so we can ask for an oral hearing. If you do nothing, you tie our hands. They do that all the time. They just don't seem to remember to do it, which is fraud. It's not, they don't forget, it's purposeful screwing the working man. So anyway, the person sends a letter to the e-comp, to the claims examiner. Now, we assist them with it. I sent a letter on this date. You're supposed to reply in 30 days. You didn't by that date. I did a second time. Now it's been over 90 days. This is the third and final time. If you do not respond within the 30-day period, which is such and such a date, I'm going to consider asking for an oral hearing to have this upgraded to a senior claims examiner. You don't have to do that. You just ask for an upgrade to senior claims examiner. But the threat of the oral hearing, when we ask for an oral hearing, usually the claims examiner balks and they finally say, it's Ellis, give it to him. It's not worth the trouble. He's going to win every damn time because he always has. He's never lost a case. And of course we're telling the truth, and we don't lie for anybody. We don't do everything everybody wants. But anyway, so we win those. Okay. So anyway, that happens on January 11th. On January 12th, the claims examiner called, pull up your file, and those 4 bruises are approved. The threat worked better than the request. That was my paralegal. So I think I was 80 years old at the time, and I thought, new way we do things here. Okay, but the law is very fair. Once you get to the level of oral hearing, ECAB, court, it's just pragmatic, honest stuff. It speaks for itself. Okay. So, said you're knowledgeable. I just want a few. I may not know shit. But I'm your number one asshole. Okay. And I require the government to obey the rules. Okay, this is J. Service-related gout and hallux, big toe, hallux rigidus, implant in the left great toe, arthritis, ouch. Okay, so the pain has affected mental health. Yeah, if you walk around with a clothespin on your finger causing pain, you're going to have anxiety, depression. It's going to change the endorphins in your brain. You're going to have an actual physiological change in your brain from chronic pain. It has nothing to do with whether your mother loves you. That's another kind of pain. So he's been diagnosed with anxiety, depression through the VA, but denied service connection. Well, if the toe and is service connected, and is service connected for wearing combat boots, because VA, wearing combat boots enough to give you a bad toe. Running around and carrying weights and stuff is enough to give you, it's enough aggravation or even actual cause to make that service connected. Therefore, your mental health is service connected. But what you don't have is a white coat that knows legal medicine, because it's not taught in medical school. Over 50% of litigation requires a doctor's report. VA disability, Social Security disability, car wrecks, Social Security, okay. And so all we learned in medical school about legal medicine is that lawyers don't go to heaven and doctors are assholes. Because we all know that, because assholes go into medicine. Medicine didn't make me this way. Okay. So you should get your anxiety depression approved. Obstructive sleep apnea. If that toe decreased your activity to daily living, you gained over 10 pounds above normal, that's service-connected sleep apnea. That's everybody. And of course, hearing loss doesn't really give you sleep apnea, but ringing in your ears interrupts rapid eye movement sleep, and there's a direct link between tinnitus and sleep apnea. Okay. Medical evidence and case law. You also have erectile dysfunction, hyperlipidemia, obesity. There's your obesity. So your obstructive sleep apnea is done. Rhinitis, if it started in the service, okay, maybe. Fibromyalgia, chronic gout. The gout probably started in the service. If you've already been approved for the gout, fine. But let's say, because gout's an hereditary disease, but let's say you're in the service 10 years and you break out with the gout. Then it makes the service connected. Probably not caused, but it happened during the service. Or let's say you have a heart murmur from rheumatic fever as a kid, and they don't pick it up on the entrance physical. And then they find it, then that heart murmur and heart and all that stuff is service connected. It should have been done a better physical. Okay. So you got neck pain, foot pain. Yeah, well, that sounds like, yeah. File for all of it. Now what you do, you go to somebody at Ellis Clinic, you go to ellisclinic.com, pull out a protocol, fill out what you want to do. We charge $500 a condition. So if you had two shoulders, it'd be $1,000. If you want DBQ with it, we've been charging $500. I'm going to be changing it pretty soon to $300. If you do a condition at $500, the DBQ will be $300 instead of $1,000. It'll be $800. But so if I haven't done that until after Thanksgiving, make a note. Save yourself $200. Okay. Now you're not required to have a DBQ, but it helps because you get in the mindset of a person at the government. Reading the forms easier than reading the narrative report. Because they go, and you go, okay. So, okay, yeah, what do you charge? So, $500 condition. So, two shoulders would be $1,000. And neck and numbness and tingling down both arms is $500. The neck includes the arms, back, down both sides. Now, hearing loss and tinnitus is $500. We don't charge for both of them, okay? But you probably can get that done at the VA without paying me. If they deny you, pay me and come in. But get your audiogram done there and stuff, because they may deny you. I had a guy Obviously had noise-induced hearing loss. The audiogram at the high frequencies, 4,000, was deep dip. That's noise. That's not old age. That's not otosclerosis, arthritis in the ear. That's clear. But anyway, they agreed, said that he has noise-induced hearing loss. But 3.5 years in artillery did not contribute. Now that's just bullshit. Come on. Now I wouldn't mind if that's Russia and China, but this is the United States of America. You lying scuzzballs. And I'm telling you, I kick your ass if we go to court. Read my transcripts. You don't ever want me in federal criminal court. And every time I've been to federal court, the stupid prosecuting attorney has not read my previous transcripts. And every time I've been to federal criminal court, the judges threaten the prosecuting attorney with contempt and even jail. You son of a bitches, take care of these people. And don't mess with them. They're my babies. And if I get mad, it's because they were throwing them in the ovens, and I'm not going to put up with it, and it hurts your feelings. Tough shit. Obey your damn law. Now, I wouldn't do that in Russia, would it? They'd kill me. I'm surprised I don't have a bullet in the back of my head. All right. In fact, I've recently went to court, and the prosecutor said, "You say you kick the federal attorney's ass?" I said, "Yep, and I'm going to kick yours." And I did. It's in the transcript. Okay. Erica, is the form CA2 valid for PTSD? Yes. It's usually, CA2 is occupational. Now, if it's a sudden injury, like you got raped, that's a CA1. But usually CA2 is fine. So you're right for PTSD. And there's a form for actual psychology and PTSD. And you just fill out that form, then you get a doctor to write a causation report, medical rationale, and do all the other things that are required by the government to get a claim accepted, which are very good rules. And their requirements are very reasonable. It's just doctors don't know how to do it. Okay, this is T-Rob. Okay, here's interesting. My caseworker, that's probably a nurse case manager in federal workers' comp, is requesting that I private check-in and check-out times for my workers' comp medical appointments to justify 4 hours a lot of time. Now, this may be they're asking you to be a spy and part of a checkout of these people. If they're 4 hours each visit, I've got some patients it takes 4 hours each time. But not every time. And so, if the doctor is not documenting it, he's going to jail. There's a clinic in Texas that 1 year billed $120 million in physical therapy and didn't document it. Even if they did it, you got to document it. You can't sell cardboard soles in military boots in Civil War. That's the law that applies. That's why it's 5 years jail, $250,000 fine if they start off. And there are a lot of people that do this because in federal workers' comp, unlike Medicare and Blue Cross Blue Shield, where I have to talk to an adjuster to get something approved, and said, I would need to do something for the state by some fools. This is Blue Cross Blue Shield. A rattlesnake's poisonous. I said, God damn, lady. But anyway, this is computer to computer. And so that just opens up a chance for fraud. There's a lot of fraud in federal workers' comp and a whole lot of fraud in Medicare. In fact, I remember a cardiologist. We had a nursing home full of very fragile people. Most of them had do not resuscitate. And he went through all those people who had a DNR and put on a Holter monitor and measured their heart for 24 hours. I said, Mike, that's fraud. That's Medicare fraud. You can't do that. And you're putting yourself at risk, you're putting this hospital at risk, you're putting me in, and I'm not going to let you do it. Now, if you do that again, I'm going to turn you into Medicare. You just got to stop doing it. Well, he did it again, and I turned to Medicare, and on the way to jail, he said, I can't believe you did this. What do you mean you can't believe it? I told you to your face. It's just easy to cheat the government. Don't do it. First of all, you're going to pay here, and you're going to pay there if you go there. Okay. So you have to determine if you want to spy on your doctor. Okay? You don't have to do that. But by the same token, if anybody goes to a doctor, I would tell you to put your cell phone on, so you'll have the beginning, end, and time, and you'll have a voice recording of everything that's said. And so then they come in, they spend 5 minutes with you, and they don't touch you, and then they deny your claim. Then you can say, I recorded how long I was there. I was in 7 minutes and 23 seconds. And here's a 5-page letter. Okay, that's fraud. Catch them on it. So that may be fraud. Now the nurse case manager, if they're doing 4 hours each time, go for it. I mean, if I was doing, by God, if I would have the beginning time, the end time, and you'd be able to look at the records and say, well, he only saw, of course, I do a lot of talking. I do 4 hours. I don't charge for all the preaching, but it may be that long. Because this is legal medicine. This is not like anything else. No one else is doing legal medicine except in federal workers' comp. So it's not medicine. The CPT codes that you use do not cover legal medicine. There is no easy legal medicine in OWCP. Okay. For instance, if let's say a prosecuting attorney came here and we're going to file charges against you. I said, you're going to be my first witness. You better memorize the FIC Act and Federal Register. I'm going to show how the federal government and all their representatives do not know the law, and I'm going to have to teach people this law. If I have to teach you how to use an EpiPen or teach you to use your insulin, and then if I have to teach you how to wander through this morass of law, then I'm going to charge for that, because the 13th Amendment stops slavery. And I can advise someone whether what would take Medicare Part A or B. I can advise things like that. You don't have to be a lawyer to do that. There may be somebody that says they are, but they better be able to cite a reference, and they don't have one. Because I'm doing stuff that nobody else is doing. I win. Because I tell the truth. Okay. I've always said, whenever you have an injury and you're asking somebody else for money, including the government, then that doctor-patient privacy should go out the window. Why don't we video all this stuff? Okay? Well, that put the insurance company doctors out of business, because they couldn't see they couldn't bill for, all those hours from the 5-minute visit. They'd have to actually touch them and take history and do all that stuff. They'd stop doing it. But it won't work, because then the normal doctors, the honest doctors, would be too intimidated to have a camera on them while they're practicing medicine. So we may never do that. But it wouldn't hurt. I've had it standing direct. I have anybody, claim caseworker, lawyers, Indian chiefs, stop by my office at any time unannounced and come see my people. I guarantee every one of them would be glad to have you come in and watch the exam and tell you their horror story. Okay? All right. And you go, oh my God, we had no clue that was going on. You have no clue what some people are putting to my people through. And that pisses me off, and I verbalize it. Here's Vicki from Washington, OWCP, that's Federal Works Comp. She wrote a letter, I reread it, realized there was a typo, the date was wrong, that's okay. Surgeon put in infusion surgery for 2020, not 2018. No big deal. If the claims examiner mentions it, you just said it's a typo. 3 independent medical exams past summer. Sounds like they are having trouble getting someone to make an opinion, or they're just getting rid of you, okay? I'm being sent to 2, but now, oh, no. So you're being sent to a urologist, which means it's probably a back with the nerves down to your bladder giving you trouble, a gastroenterologist, and those are hard to find. That'll do federal workers' comp. In fact, if you find them, tell me, give me their name. I'll send people from all over the country to see them. Test reports. Now, Cauda-Equina syndrome, that's when all the nerves, about right here, the spinal cord ends, and then all the little nerves spread apart, okay? All right? And so you can have something here, or you can have down here, and then the nerves down your legs are bothering you. And it's different than, let's see. Here's the spine. Here's a nerve down, let's say this goes to little toe, big toe. The Cauda-Equina is up in here. And it's going to not show up on EMGs and like normal, okay? All right, so, okay. had 2 EMGs in the last year, show no nerve damage. That may be because of the Cotter-Quine syndrome. Can doctors do them wrong and not show damage? Sure. But it's probably the Cotter-Quine syndrome. It's not picking it up. Because it's like, those nerves are like spaghetti in water, and you're not pinching them long enough to kill the nerve, to make the lining, the covering of the insulation to die. And so it's just intermittent pain and pressure, and it won't show up for a while. Big toes are both numb. That's an L5 nerve next to the bottom disc. Constant tingling in the lower legs, weakness, bilateral foot drop. Now you got two nerves in each leg. Okay. Now you're on the periodic rolls. Okay. Now, if you get a scheduled award, the periodic rolls, the workers' comp stops. So you don't ever want to get a scheduled award, unless you had a kid going to college, or you had cancer, and you knew you were going to die in a couple of years. Then you take a lump sum, pay a 4% penalty, and get on with your life. But you stay on the periodic rolls till you die. That's pain. You got to come into the doctor every so often to be tested, and which is only fair. The government can't just give you a check that you need to have it looked at, and that makes it hard, because your doctor may say, "Well, I don't want to just see it, just write another letter saying nothing's changed." Well, we need that. We need to say, yeah, and which obviously you're not going to get better. It's going to get gradually worse, right? But you're going to have someone write it down, and a white coat has to do it. So a doctor may feel funny about that, and please bill the government for that doctor, so that they will have it in the database you're actually seeing. Okay. Here is Texas Will. Nexus letter. Okay, annular disc bulge. Okay, this is the annular fibers around the disc, and this is a bulge. That's a herniation. Okay. Physical separation, physical. You had radiculopathy. In other words, it's pinched the nerve down your leg, like you hit your funny bone. Those two fingers go numb. Okay. The Rays not rated me on that for some reason. Okay, let me tell you the reason. It's not the VA's place to write your nexus report. First of all, it depends on what state you're in, what person you see, but nobody's had real training in legal medicine and how to write a nexus report. Wow. And so they're not going to. For instance, I have a doctor who helps with the VAs, and he works for a company, and he gets letters saying, "You're finding a lot of extra stuff. That's a threat." In other words, that would be hero, I would think, but they think that's bad. Now, if the insurance company wrote that, I can understand that. Quit finding new stuff. We're paying you. Okay, that's their job, but not the federal government. They're supposed to be honest and in the middle of the road, and if you're finding extra stuff, you're a hero. I was talking to somebody a couple weeks ago. He actually works in the VA, and the internal memos call people that help veterans get their VA disability predators. I call them heroes. Because a veteran working for the government, when they're in service, their life's on the line. And I don't care if they had this job in Hawaii the whole time, their life was on the line. And they could have been on food stamps. They put their life on the line for the United States of America. Take care of them. That's the law. Congress knows what they're doing. Very fair law. Okay, so he had radiculopathy. Now he gained weight, of course, and the weight gain is now service connected because you have a bad back and it hurts, and you don't exercise like you do to. Your separation physical showed the weight gain. Now you've developed hypertension. That's service connected from the back, from the nerves, from the weight gain. Sleep apnea, same way. Diabetes, chronic kidney disease, all not slam dunks, easy to do. Now you'll probably get turned down the first time, but then you go to the Board of Veterans Appeals. The judges are lawyers. They know the law is very pro-veteran, and they'll just slam dunk it. Go Google Board of Veterans Appeals, VA Veterans Appeals. Google Ellis. Okay, based on Ellis's nexus report, remand. Because I tell the truth, and I make it simple.
Meaning they're sending it back to...
Yeah, send it back. Remand. Start over. You screwed up. You missed it. Ellis found it. You do it. Okay. So the link, that link, that's all easy. Okay. So okay, my individual doctors will link the sleep apnea, hypertension, and obesity. additional links. Primary sleep apnea, diabetes, hypertension, disease, hypertension, my diabetes, my kidney, diabetes, kidneys, hypertension.
I know, and I was just even
Sleep apnea. Happy Thanksgiving and God bless you, everyone. Sorry about the problem with the video. It seems that the camera decided all on its own that it was a wrap. Enjoy your turkey and football, everyone. Come see the Hick Doctor in Oklahoma. You'll be glad you did, just like all these fine folks who came from all over America.